Today we are talking about blood pressure and pulse. First thing we need to write down is the definition of blood pressure. So blood pressure is how hard the blood is pushing on the walls of the arteries. So when the heart pumps this blood, it is putting pressure on the artery walls. We compared the arteries and veins to hoses, like water running through a hose. And so if we turn that faucet on really high, there's going to be a lot of pressure pushing on the outside of the hose. And that is what blood pressure is. Literally just blood pushing on the walls of the arteries. When you go to the doctor, they take your blood pressure and they give you two different numbers. Those numbers refer to two different things that are happening inside of the heart. So one of those numbers is called systole. Systole is when our ventricles, the bottom part, is contracting. Remember, the ventricles squeeze and push blood out of the heart. Either it's going to the lungs or to the rest of the body. And if we're squeezing really hard here, that's like turning on the faucet at full power. There's going to be a lot of pressure in our arteries here that are going away from the heart. The other number that they give you at the doctor's office is called diastole. And this is when the ventricles are relaxing. So that's this picture. And so you can kind of think about the ventricles relaxing. That's like turning off our faucet. When we turn off our faucet, there's not a lot of water moving through our arteries, and there's not going to be a lot of pressure. Now, this happens really, really quickly, right? Your heart beats boom, 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 boom. So every time it's beating, that's that squeeze, relax, squeeze, relax, squeeze, relax, okay? So when I say we're turning off the faucet here, it's just like a temporary shut off. So all the water or all of the blood that's already in our arteries is going to continue to flow, but we're not adding any extra pressure. So when you go to the doctor, they tell you a number over another number. So we're going to write all of this down. So your blood pressure is systole over diastole. So the pressure in your arteries when the ventricles are contracting and the pressure when they're relaxing. So that is your blood pressure. Normal means you want anything less than 120 over 80. Why is the top number higher? It's higher because that's when our ventricles are pushing lots of blood into the arteries, so there's going to be a higher pressure. And then our ventricles relax, and that's the number diastole. So if we take a look at this chart here, you don't have to write down anything. Normal for the top number is less than 120. Okay, and normal for the lower number is less than 80. You can see if you have elevated blood pressure, they'll tell you it's between a 120 and 129. If you have high blood pressure, stage 1, stage 2, etc., these are the blood pressures that you might have. Okay, so there's a bunch of different factors that can influence blood pressure. You might, if somebody's like really angry or upset or nervous, right, you might talk about their blood pressure increasing. So emotions can influence your blood pressure, which is why at the doctor, I don't know if this happens to you, but sometimes at the doctor, when they get out that blood pressure thing, I'm like, oh my gosh, is it gonna be normal? And so I kind of get a little nervous. So it's probably higher than it normally is when I'm at home. So if we think of our heart and our blood vessels as these balloons, okay, right, the pressure, what would happen if we made the balloons smaller? Would there be more pressure or less pressure if we were trying to fit the same amount of stuff inside? So if we made our balloon smaller, there'd be a higher pressure because we're still trying to fit all of this stuff but in a smaller space. So your blood vessels can actually be made smaller. There are fat deposits that can accumulate along your arteries, and that can make your blood vessels narrower, and that can increase your blood pressure. What would happen if we added more water to this balloon? Would the pressure be higher or lower? So the pressure would be higher. You can add more water to your bloodstream by eating a lot of salty foods. So salty foods cause water to come into your bloodstream, and that's going to create a higher blood pressure. That's why if somebody has a high blood pressure, they tell them to reduce sodium, reduce the salt in their foods. And what about if we have less water in the balloon? What would happen to the pressure? The pressure would decrease. So when would you have less water in your blood? Well, if you're really dehydrated and you're not drinking enough water, what happens is the amount of blood in your bloodstream decreases because there's less water. So if you're dehydrated, you're going to have a really low blood pressure. So these are all factors that I just wanted you to think about. You don't necessarily need to write any of that down. You can write this down though. So high blood pressure, why is it bad? Well, if you're constantly pushing on the walls of those arteries, your heart has to kind of work harder to push that blood through. Like imagine if we have some narrowing of our arteries because there's some fat deposits, right? The heart has to push harder to get the blood through that spaces. And so it causes our heart to work extra hard. And over time, these are risk factors that can ultimately lead to a heart attack or a stroke. So we're going to flip to the page in our notebook or in our notes that says diseases. We've talked about a variety of diseases. And so we have a couple diseases we're going to write down. And then we'll go back and talk about your pulse. Okay. So we're going to write down heart attack. So a heart attack happens when one of the arteries in your heart becomes blocked. How does it become blocked? Well, fatty deposits build up, okay? And if they build up or travel to your heart and block off part of the blood vessels that supply oxygen to the heart, part of your heart muscle actually dies. This is why heart attacks are really serious. So they can go in and they can add like a little balloon or what they call a stent, a little wire mesh thing that opens up the artery. Or maybe they have bypass surgery where they build a little artery that goes around the blood clot. But heart attacks is when one of the arteries becomes blocked, and it's one of the arteries in your heart. Sometimes if we have a blockage, it can also travel to our brain, right? All of our blood vessels are connected. And so these blood clots, these fat deposits that then can kind of turn into blood clots can travel. And so a stroke happens when a blood clot travels to the brain and prevents blood flow. So what happens here is the arteries, okay, they have this buildup of fatty deposits. And sometimes our blood cells kind of mistake them for damaged arteries. And so they'll kind of form like a blood clot here, the platelets will. And if that breaks off and then it travels to the brain, it can actually get lodged in a really in a small vessel. And that's what causes a stroke. And what really is happening is you're preventing blood flow to part of your brain. Some of those brain cells can end up dying. So you might be asking, well, Ms. Frankson, I don't really understand. You're using blood clots, but fats? I don't really get it. How does this all work? Here's how it works. So when these fatty deposits end up in your blood vessels from eating a really high fat diet, it builds up what we call plaque. Okay, they're fatty deposits. And what happens is sometimes these caps on top of these fatty deposits can rupture. And the body says, oh my gosh, the blood vessel's broken. It doesn't really understand that this is a fatty deposit and it's not the blood vessel that's broken. And so they're like, hey, we need to form a clot. So platelets come and they build a clot, which is a problem because it narrows this artery. Sometimes it might block it off completely. And if it blocks it off in the heart, this is an example of heart attack. If this clot breaks off and travels to the brain, then that's an example of stroke. So we're going to flip back. We have a few more things to write about pulse. So just go back to your blood pressure and pulse page. flip away from your disease page. So your pulse, you can measure your pulse. They might measure your pulse at the doctor's office as well. This is the number of times your heart beats in a minute. When you're just resting or sitting around, your pulse is going to be lower. When you're exercising or doing some hard labor, your pulse is going to be higher. And the reason is because you have to, your muscles are needing more oxygen, so your heart has to pump faster to bring more oxygen to those muscle cells or the cells that need it. And our cells need oxygen because that's how they're going to generate energy. So where on your body can you check your pulse? Go ahead and tell me if you know. You might have said your neck, you might have said your wrist. Right? Both of those are great places to check your pulse. So we're going to write down, you can check it on your radial artery, which is your wrist, or your carotid artery, which is in your neck. They always tell you to use your fingers, not use your thumb, because your thumb has a pulse in it that you can feel pretty heavily, and so you might not get accurate results. And so what you're actually feeling when you have your pulse is the rush of blood through the artery. Remember we talked about blood pressure? Well, when your heart squeezes the blood out into those vessels, as that blood comes through, it causes the blood vessel to have a high pressure in that specific point, and then it kind of relaxes after that. I like to think of this as kind of like, you ever seen a snake eating like a mouse, right? When the mouse goes along the snake's body, you can see it as the bulge, right? And it moves. This is kind of what happens, except it's just blood flow pulsing through our arteries. And so as our heart pumps, when it squeezes that blood out, we get this surge or the rush of blood that causes our arteries or our blood vessel to expand. And then it recoils or goes back. So that's pulse, number of times your heart beats. Blood pressure is the pressure against the walls.